Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello, everybody, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me today is a non-ops sports medicine doctor, Abbie Metzler. Was I close?
Yep,
Mostly got it?
Perfect, yep.
Okay, perfect. And the head athletic trainer for the School of Mines Hard Rockers, Kaleb Birney. Mm-hmm. Thank you guys both for joining us today. I appreciate it.
Thank you for having us.
Yes, absolutely. And a reason why I think this is such a topical thing to discuss on this podcast right now is because over the past couple of months, your profession has been all a lot of people have been talking about for one very specific reason, I think. And I want to talk about Damar Hamlin and the accident that happened to him on the field coming up. But first, let's just get into sports medicine a little bit. I'll start with you, Abbie. Why did you choose this?
For me, sports medicine has been something that I've always loved doing, but I always say I like quote-unquote cheesy medicine. I like helping people do what they want to do. So whether it's an athlete getting on the court or if it's your grandma getting back to knitting, it's essentially all-encompassing and staying active, and that's what sports medicine kind of is at its bread and butter, is keeping you moving.
I think that's the least cheesy thing I've ever heard, honestly, because it's something that, all of us, we all kind of want to be athletic. We used to think we were athletic. And yeah, I think that makes a good point too, is it's not just the athletes that you're dealing with, right? Yeah. So Kaleb, why did you jump into this whole thing?
Yeah, so I've kind of in a way been doing this my whole life. My dad was a chiropractor back in Kansas in a small town, and so he was the only healthcare in town. And so we did all the physicals for all the high school athletes. He was typically on the field just to kind of be there. He would tape some wrists and ankles as best as he could, but he was just there.
Right.
And so I've been on the sidelines since I can remember. We didn't do a ton of games, but every once in a while we'd be down there and I'd get to help him and stuff. And so that's when I kind of figured out what it was when I was looking at colleges and stuff, and then just kind of took off from there.
So did you guys play sports?
Yeah, I grew up in a small town, East River, Flandreau.
Okay.
So I actually played sports year-round.
All the time?
Yep.
Everything that you could do, you could step on the field and do.
If you couldn't do one thing, they were saying, hey, you're going to do this, and you're like, okay, sounds good, and you just jumped and did it.
The same with you, Kaleb?
Yeah,
you into it as
same.
Well?
I played everything I could growing up, was very active. Basketball was a big one for me, track and field, cross country, so those are some of my main sports, though.
You look like a runner.
I was.
Well, let's talk, for people that don't, you hear the term sports medicine, and I think a lot of people, when they see and they're watching like a lot of professional sports or college sports or high school sports, they'll see somebody on the sidelines, maybe with a kit or a bag that's there to help. But what in general is sports medicine?
I think, like in a broader sense, the way to think about it is this interdisciplinary team all coming together to take care of the athletes. Because there's so many different parts of it. You have your physicians, you have your athletic trainers, you have your nutritionists, you have your strength and conditioning. There's actually just a lot of different elements to it that all come together that make up your sports medicine team. But the one you're seeing on the sidelines are often your athletic trainers and then your physicians that are also helping doing that coverage.
So are there always physicians, like let's say high school games around here or the college sports with the Hard Rockers, let's say, are there always physicians on hand for those types of games?
So our college games, yes.
Okay.
Those, we will always have a physician. Our bandwidth for like high school, we do football for sure because it's your highest rate of injury, so you want to make sure you have people there at those games. And then it's kind of sprinkled in the rest of the high school, like basketball and other events.
Okay. So then what's your day-to-day like then? Let's just start with you, Abbie.
Yeah, my day-to-day is kind of interesting. It's very atypical, I would say, for a physician because I help cover Hard Rockers, School of Mines. I do 1 half day a week up with Black Hills State, and then I also help with our indoor semi-professional football team, the Rapid City Marshals.
Yeah.
So I run clinics for them essentially, and that kind of takes up my mornings during the week. Then the other part of the week, I'm actually in clinic in our orthopedic center up at Monument Health. So my day is kind of, I jump around, and then I also do administrative work and try to help grow our sports medicine presence kind of in the community here.
So when you say you're doing clinics in the morning, what does that generally mean?
Yeah, so the clinics for the athletes is actually primary care and orthopedics, so it's kind of their stuff that comes up during the week, and it's kind of their direct line of access to a provider so that we can keep them on the court. Because a lot of times, what will happen with athletes is something will happen, and you're trying to get into somebody, but timing is everything with sports, and how to get somebody back onto the court or onto the field is really important. And that's what I kind of just serve as, is that mediator between that.
Okay, so Kaleb, what about you then?
Yeah, so I kind of, when people ask me my day-to-day, I kind of split it into two time frames. There's in-season and out-of-season.
That was going to be one of my questions to kind of go along with this, is there has to be a part of the year where, there's no sports being done, right?
Correct. I mean, summer,
Sure.
at least at the collegiate setting.
Right.
So I primarily cover football and golf. Those are kind of my two sports, and then that kind of gives me some extra time. Like right now, I do a lot more administrative things. Looking at our policies and procedures, looking at our emergency action plans, kind of working on that. So I'm kind of a more 8 to 5 kind of guy right now. However, football is doing some winter conditioning, so there are twice a week. I'm usually in around 6 a.m., and then I'll leave a little earlier on those days. During the season, basically starting in August, I always joke that I don't get to see my family then because I'm with the football team all the time. Whether we're up early at 6 a.m. for early morning practices to get in some, before the heat comes, and then at school mines during the school year, we actually practice from 5 to 7 in the evening. And so then that means I'm getting home closer to 8:30, and so I have some later nights like that too. And then obviously game days, you see the 2-hour game play, but I'm typically there 8 a.m., but then the game starts at 1 or noon, and so then, and then you got to clean up afterwards too. So it's typically I get home at like 5 o'clock after a 1 o'clock game or something like that.
So when a game's going on, you're you're on that sideline. You're one of the guys we'll see there, just kind of ready to go.
Yeah, and we have 2 athletic trainers that work specifically with football.
Okay.
And so we kind of split up offense, defense, and then you kind of just put yourself in a place where you can kind of see the whole play. Typically, myself and Hannah is one of the athletic trainers at the university that works football with me. We split up, so one of us is kind of looking at the offensive line, and the other one's kind of looking ahead of the play. So that way we have 2 eyes on the most specific areas that we typically will see the injuries.
And so you're not just standing there waiting for something to happen. You're kind of anticipating, in a sense, then as well.
Yes.
And I suppose that plays a pretty big part of this. You're just like the coach. Well, mostly. I mean, probably more important, honestly.
It's actually a large part of what we do
Yeah.
is trying to predict injuries and trying to prevent them from happening in the first place, right? So you're kind of keeping your eyes and ears and looking around, even if that's preseason, during practice, or at a game. You're just trying to look out for those things, and it's the constant kind of ebb and flow of what we do. Yeah.
Are you there as well? Are you
Yep,
there
at
for the
games.
entire thing? For college? For
Yeah,
the
yeah.
University level?
Yeah, they are. Obviously, they're much earlier and much later than we are. They are our eyes and ears, and they are our first line for everything. But yes, we're there, and they're going to do majority of what it is, and we're there if something kind of escalates up into needing more care.
Okay.
So we're kind of hands off until they say, "Yep, we need some more help," and then we'll jump in.
I see. So you have, I think you mentioned it a little earlier here. There's the athletic trainer and the team physician and the team surgeon. And there's a strength and performance team as well. So you guys all have to work together during this. I can't imagine the surgeon is standing there on the sidelines too, though, are they? Are they really?
Yep. Especially with football, you have 2 physicians. You have both primary care sports med, and then your orthopedic sports medicine, both there, because both can pop up during the game. So
Well, as far as has it ever escalated like that, like with a Hard Rockers game or anything, where the surgeon's been needed, that's been standing there?
I mean, yeah, he actually probably gets more time than just primary care, because typically with football you're going to see a lot more of the sprains, the strains.
Yeah.
We're looking at knees. So if somebody goes down and we're concerned about an ACL or a meniscus tear in the knee, we're going to pull him over because that's more of his specialty.
Okay, so let's say that happens. Let's say a play happens, running back goes around the right side, gets hit just right, and is laying there grabbing his knee. What's the first thing you do then when you see that happen?
Well, I put in my running skills and run over to him.
Yes, the cardio's
Yeah.
great shape for them.
And then, so we do a quick little evaluation on the field. A lot of on the field is actually us trying to calm the athlete down.
I suppose.
Because they're in a lot of pain. They're freaking out because they don't know what's going on. They just know, hey, this hurts. Why is this hurting? And so really most of the time I'm out there, we're just trying to get them to breathe, get them to calm down. If we can get them to that point, then we'll do a quick evaluation on the field. We want to make sure that there's no fractures, nothing imminent that we need to use EMS for.
Okay.
So basically, once we get out there, it's just a full-on quick examination, make sure they're okay, we can get them off the field safely, then we either get them off, and like in this situation, that's when we get them off the sideline. I'll typically do an evaluation then, and then if I want second opinion or if I just want to make sure I'm not missing anything, then we'll pull the orthopedic surgeon over, and then they'll do another evaluation and just kind of make sure that we got everything right. And then from that point on, we would potentially get them some crutches or ice or just some compression to keep the swelling down, and we basically start treatment as soon as that
right
injury
there.
happens. Yeah.
Well, you kind of do it. Then what's your role in a situation like that, Abbie?
Yep. So, sometimes, at our high school levels, I would be the person that they would pull over, right, to help diagnose, okay, do we think this is an ACL? How are we going to follow up from that? A lot of times, too, from like a college standpoint on, when we have both people there, I'm doing more of the gen med, like, okay, is someone having an asthma attack? Are they having some more of those other, the other systems in our body that can start going wrong with us? I'm kind of standing in as that acting person there.
Okay. Is it more serious to have a torn ACL or a broken bone?
I think that depends on
the
how.
bone.
Yeah, exactly. Yeah, I think in most cases ACL is probably going to be worse, just because the return to play is so much longer.
Why does it take so long in an ACL tear to get back to? I mean, can you ever come back from it like 100%? And I suppose if you're an athlete and you're conditioned, that probably helps quite a bit. But why does it take so long?
A lot of it's the rehabbing and like the different components that I'll go back into it. Because an ACL, it's right in the center of your knee, and it's really important to that stability of your knee. So once they have to repair it, you have to be really careful, because then like the quad starts to shut down. And so it's this whole making sure that the proprioception of your knee is stable enough to take it again once it's undergone surgery. So we have to be able to get them back. Your return to play for somebody who's actually going back to high-level play is going to be much different, because we have to ensure that that knee can handle all these different movements and that it's not going to re-tear because we put it in a vulnerable situation.
And so a broken bone seems a little more straightforward than in
I would say in
I
general,
suppose.
unless there's obviously there's certain bones, like if there's pinning and all that stuff that needs to be done to help stabilize the fracture. But yes, the rehab process of an ACL does take quite some time. And I think that's something too that we see a lot of is, someone will tear their ACL, and to us, we see it so frequently that we're like, it's like he said, a lot of the calming down part of it.
Yeah.
But really, once we get stabilized, things can wait, because people want to rush to the emergency room. They're not going to do anything more than get an x-ray, and now you have this huge bill. So like that's another part where we kind of jump in and we can help triage that for you, get the brace on, get it locked out, make sure that that's not going to get worse on you, and then make sure that you can kind of follow up and hit the right people for follow-up versus getting stuck with some big bill that's...
Will we ever reach a point where we can do things to protect that enough in sports to where it doesn't happen? Or will that always be just one of those freak things that no matter what we do?
Yeah, we do a lot to try and prevent it best we can. So when they come in early on, they'll do a pre-season physical with us, and we actually go through any pre-existing stuff. So if we start to notice there's certain, there's valgus deformity of your knee, you're more susceptible to ACL. So there's certain things that we can catch on that first physical that then we say, okay, we need to do a prehab program. So essentially that is before anything ever happens, we're going to try to prevent it best we can. Now we can minimize that risk, but we can't ever take it away. I mean, you're playing contact sports.
Right.
And, our ergonomics of our body are ergonomics of our body at some point.
Well, when you're getting hit that fast and that hard, I suppose there's you can only do so much. We're kind of focusing mainly on like the football side of this too, but you mentioned golf.
Yeah.
And I'm assuming that these same kind of injuries can happen, can't they? I mean, more freakishly, I would assume.
Yeah, golf, you see a lot more what we consider overuse injuries.
Okay.
I see a lot more backs, a lot more wrists, elbows with them. Typically from just swinging so much.
Yeah.
And so we do a lot of, I call it kind of more reducing injury prehab, because you can't prevent an injury completely.
Right.
But it's, so we do a lot of just, strengthening things, and then they do stuff downstairs in the weight room. So that's where me and the strength coach really team up, and make sure that we're hitting all the muscle groups that we want to hit, making sure we're hitting the minor muscle groups, including the major muscle groups, but then at the same time protecting them so when they do have an injury, that we can continue to get them stronger,
Okay.
but then protect that area as well.
Okay, so of the major sports, safest one to play? Hockey, basketball, football, baseball.
I was going to say couch potato. That's really not safe either.
I have perfected that, so don't worry. I'm very good at it. But is there one that's more safe than the others?
I would say our injury rate wise, the ones you just listed would be baseball.
Okay.
You have less with hockey, football, those high impact contact type injuries occur more frequently. Now you're still gonna, have your injuries, but I would say just out of those big ones, out of the ones you listed, but you have your track and field, your golf. You start looking at different types of injuries.
Okay. Well, we mentioned earlier when we started this podcast that, over the past couple of months, sports medicine, everybody became super familiar with it because of a very specific thing that happened in the NFL. That honestly isn't that uncommon, I don't think, in the sense that we've seen it happen with kids in baseball getting hit in the chest with a baseball, or another in football mainly getting hit there too. And of course, it's DeMar Hamlin, who was. It had to have been just that. He probably could have had a better chance of being struck by lightning, from what I've understood, than what happened to him on the field. Can you guys explain a little bit what did happen to him there?
Yep. So it's essentially getting hit at the perfect point in your cardiac rhythm,
right,
that it actually causes it to stop. So it has to be so specific at what point that your heart's firing that it actually causes it to stop. And that's so he just took it at the right, like you said, with baseball, that's where we learn, when we learn it in, for boards, say for sports medicine, you hear it, baseball player took a ball to the chest, because you have to get hard enough for it actually to kind of your chest wall to recoil back onto your heart and to cause that. Because
you have, when you just feel your chest kind of where your heart is, it's amazing that anything could get, aside from just a horrible car accident or something, right?
But that's why CPR works, because we can get to it, right? Because that's the whole point of CPR, is that recoil on that heart, and that's pulling that blood in. So it's the same thing. You're just pushing that chest cavity in fast enough and hard enough at the right time, and it causes it to stop.
When those guys ran out on the field, right when it happened, obviously this isn't a moment of calming him down, because right away that he's unconscious.
Yep.
So then what happens? What's the very next step once you see that?
Well, I kind of what I watching it too. It's the NFL has roughly 30 healthcare professionals on the field.
Wow.
Because they expect these situations to happen, so they train for those. And so basically, what happened was they saw him fall in a way that we don't typically see people fall.
Because he was able to stand up for about 3 seconds, and then fell.
And so as soon as they noticed the fall, they actually started calling in everybody immediately.
Oh wow!
And then it's just a they already have people planned on who's going to be doing the CPR, who's going to be calling the surgeons or the physicians over, and the EMS. All that is planned pre-game in what's called a medical timeout, and where all the teams get together, the officials get together, all the physicians, everybody's together, and so they already have everything planned out, who's going to be doing everything that they're going to be doing. And so then it's really just doing what they've practiced.
So how hard was it to get through his equipment, though? That to me was so amazing. Because in order, like you were saying, Abbie, to start those compressions on his chest, well, you got to strip everything off him to begin with. And that, and every second counts here, right?
Yep.
Yeah.
It does. And I think that's the big thing of when you have your athletic trainers and people who know all their equipment out there. So we do the same thing here at our high schools and our colleges. We have this discussion of okay, if someone needs spine boarding, are we removing the equipment? Who's removing it? How does this happen? So that's all discussed and figured out beforehand, like you said, to get through that equipment and how it's done as fast as possible.
I'm just in talking with you guys and how your teams work together. It should give any parent that's listening to this right now that are worried about their kids going into sports, it just should kind of be like wow, they do have these people that are there and available and ready, and you guys know what you're talking about and you're ready to go. It's not just one person on the sideline that's standing there ready to make those decisions. So how often do you guys go through training or updates on stuff like this? Is it pretty frequent?
It's about the beginning of each year.
Okay. Oh, yeah. So it's every year. Okay.
Yeah. And it's just kind of deciding, because it is done slightly different from our high school to our college level. So it's just making sure that everyone's on the same page. If something happens, how is this going to get done? And so we have like emergency action plans that are done for each location even. So each high school's is a little different. Each college's is a little different because your AEDs are going to be in different spots, and who's running what is going to be slightly different based on the personnel that you have at hand.
So is that like one of the major differences between high school and college? Is that kind of, or how do they differ really when it comes to this?
It's going to be a lot more encompassed at a college setting. You're
Okay.
going to have a lot more personnel available with you. You know, at a high school setting, you're a little bit more. You're going to need as much help as you can, but it's going to be calling that EMS in and doing all that, because it's going to be your one athletic trainer and one physician typically,
Okay.
or it might just be your athletic trainer.
All right.
Right, and so it's using your resources as quick as possible.
So do you guys, do you have a sport that you like working better than another? I mean, not that you're not, professional in the whole thing, but do you have some that are just a little more exciting that you like to do more?
Yeah, I think it's football and basketball. Mostly basketball because I played it.
Oh, yeah, okay.
At my last institution, I worked basketball, and I worked basketball at some other Division I schools and stuff like that I've been a part of. That's just a sport I understand really well.
Yeah.
And so when you're, not only do you get to help treat the athletes, but you also get to just enjoy the game.
Right.
And then football for me is always just fun because it's so busy. There's 100 athletes, 100 plus athletes, and you're trying to take care of all of them. And it's exciting. Every game is mentally exhausting because every play. I mean, you think about it. We probably average 70 to 80 offensive plays, and then defensively we're hopefully in the 50s or 60s. But we could see over up to 200 plays in a game, and every play is like 4 seconds, and it's 4 seconds of just what's going to happen. Like what am I
Just
preparing
sheer
for?
controlled chaos
Yeah.
is what it is. What about you, Abbie? Do you have sports that you prefer?
I would say it's probably actually very similar for the same reasons.
Yeah.
Like football because you're on your toes the whole time.
Yep.
Basketball because I played it and I played a lot of it. For me though, I kind of also like these different kind of challenging myself. As a physician, I actually bounce around more, and I would say, I did some stuff with boxing. I've done stuff. I actually worked a professional pole vaulting tournament. Or I don't know what
Some
you call
of the sports you wouldn't
Yes.
even think of, but of
but
course.
like you have to have somebody there for
Right.
risk, like mitigation type stuff. And so I kind of like challenging myself to like sit there and think, okay, what could go wrong, and then
Yeah.
try to like start playing it through in your head. Like at the pole vaulting, someone actually missed the mat. And so how do these, and it was professional, but it's
I
just
did
your
that
pole.
once.
Yeah. And it's just thinking
embarrassing.
it through in your head of what could happen,
Yeah.
and then challenging yourself to just be prepared for that.
Awesome. Well, you guys, this has been great. I have 1,000 more questions, but I can't turn this into a 3-hour podcast. So, Dr. Abbie Metzler with Monument Health and Kaleb Birney, the head athletic trainer for the School of Mines Hard Rockers. Thank you very much for both coming in and talking about this. I appreciate it.
Thank you for having us.